to start to address some of that pain. We're starting with the quad because this is really uncomfortable. It's really sensitive. It's really hot and inflamed. And getting in and going to town on that typically doesn't feel good. But if we start by addressing the quad muscle tension, we can decrease the amount of pulling or tension that's going on here and start to move in the right direction. So the first option for them to do on their own is a massage stick. So from the top of the kneecap up towards their hip, semi-forceful, moving from the inside over the top and then to the outside. So I'll typically have them spend 1 to 3 minutes doing that. When they hit an area where there's increased tension, it feels like a speed bump, it's a little bit more sore, they're gonna shorten up their stroke and spend a little bit of extra time on that. That's option 1. Option 2 would be a percussion or a massage gun, same pattern. They're gonna take that up and down, moving from the inside to the outside, over that quad muscle group, focusing on any areas that are a little bit more tight or a little bit more sore. The next option is gonna be for them to do a little bit of scraping on their own. So a little bit of lotion over that muscle tissue. So big sweeping strokes, again, moving from the inside to the outside, all the way across. We can go up or down. This is one that the parent can do to assist, or they can do on their own. Yep. So you can hold it with one hand or with 2 hands, firm pressure, sweeping strokes up and down, moving from the inside to the outside. I typically will have them go all the way inside to outside, up and down 3 times. This does need to be directly on their skin, not over the top of clothes, whereas the roller or the massage gun can be over the top of clothing. Once they've gone back and forth 3 times, then they can try to hone in on some of those tight spots again. So if they feel a tight speed bump in the middle, they can do shorter strokes over the top of it, or they can come down to this quad tendon if that's a little bit more irritable and do some shorter strokes there. Once we've gotten the quad muscles to settle down a little bit, which is going to take more than just them doing it on their own once, they're probably gonna have to be pretty consistent with it on a daily basis. But once that's a little bit softer and a little bit less reactive, then we can come in directly to the knee joint complex, into that patella tendon and around that tibial tubercle. So a little bit of lotion. And again, this is something that the parent can do to help, or they can start to do on their own. So we're gonna start at that tibial tubercle and kind of sweeping up. This is typically the spots that is the most sensitive, so we don't need to go at it aggressively. But we do want to start to address that tissue a little bit. And again, they can do that to themselves. Good. You can also take both hands and kind of make that J-type motion up. Good. Once they've gotten used to what pressure and sensation around that area feels like, we can add the scraping tool. Again, we're not gonna go in and be super aggressive because this area is already inflamed and sensitive. We're gonna stay off the tubercle and focus more on that patella tendon. So it's gonna be short strokes, pulling up the tendon. We can get in on the medial side and on the lateral side. You can see this is a little bit more uncomfortable for her than being up in her quad muscle was, because this is that hot spot still where the body's reacting to that change in pressure. So while we're working on this, we're decreasing her training volume, but we're not having her stop completely. Stopping completely does help in the short term with the pain, but it doesn't do anything to address her load capacity. So then as soon as she starts back up with her activity, the pain is right back there. So we want to decrease the volume and decrease the load in the motions that are painful without stopping completely, while we address the tissue health and the tissue reactivity. So for her specifically, we are reducing the volume and how many reps she's doing on her hitting approach and her landing, because that jump and then coming back down. So we're not doing extra reps after practice. We're not doing extra reps on the weekends right now. We are supplementing a little bit of K-tape, which we have a video on that if K-tape is something you're interested in. And we're using it just to help support this, to take a little bit of that load off that tibial tubercle and the patella tendon. And then she is being diligent daily about getting in and doing the work for her quad muscle group. After we've made a little bit of change, we add in some activation exercises to start getting those muscles to fire together better. And then we start adding progressive load and getting more aggressive so that we're building capacity while we're decreasing load, so that when she is ready for full return to sport, she has the capacity to do that, and we're not going to just flare this back up.